Nutritious diet and its importance. A nutrition education video. In today's world, the incidence of various lifestyle diseases is high in number. The importance of proper lifestyle in preventing diseases and in maintenance of health is often overlooked. The time is changing and people are moving towards health oriented practices and are taking efforts to be healthy. But a majority of the population is still lacking the knowledge about the importance of nutritious diet. This knowledge gap affects women population more because of the higher nutritional requirements of women during their reproductive age and may give rise to various health disorders. Women's health is very important during all walks of life but is especially of prime importance during reproductive age. A nutritious diet is the foundation of a healthy lifestyle. Beyond weight loss and maintenance, eating a balanced diet is crucial to a woman's overall health. Good foods provide nutrients that are important for growth, well being, and development. Maintenance of health status among women is significant as health problems should not be a hindrance to a woman's way to accomplishment. What is nutritious diet? A nutritious diet comprises of foods that contain naturally occurring nutrients and contributes to good health. It is important to consume a wholesome and nutritious diet in order to improve the health status of women. A nutritious diet helps to protect against deficiencies in all its forms as well as non-communicable diseases such as diabetes, heart disease, stroke and cancer. Unhealthy diet and lack of physical activity are leading global risks to health. It is important to keep in mind that there is no one food that creates health. A well balanced meal full of nutrients give fiber, proteins, carbohydrates, essential fats, minerals, and vitamins necessary to function and live optimally. Now we'll move on to nutrients in food and their recommended intake per day and their functions in our body. The nutrients in food are divided into micronutrients and macronutrients. First, we'll see about the macronutrients. The first macronutrient is carbohydrate and its recommended intake per day is 130 gram. Its major function is to provide energy for all bodily functions. Next is protein. Its recommended intake is 36 gram and it is the building block of all the molecules in the body. Next is fat. Its recommended intake is 20 gram. Fat is the fuel source of the body and it is the storage form of energy in the body. It helps in absorption of various nutrients. Next, we'll move on to micronutrients. The first micronutrient is vitamin A. Its recommended intake per day is 390 mg. Vitamin A helps form and maintain healthy teeth, skeletal and soft tissues, mucous membranes, and skin. It promotes good eyesight. Next is the B complex vitamins. The B complex vitamins are thiamine, riboflavin, niacin, vitamin B6, and vitamin B12, and its recommended intake per day is given in the tabulation. These vitamins aid processes that the body uses to get energy from what we eat. They also help in the formation of red blood cells. Next is vitamin C. Its recommended intake per day is 55 mg. Vitamin C is needed for the growth and repair of all tissues in the body and it is also required for immunity. Next is folate. Its recommended intake per day is 180 mg. Folate helps tissues grow and cells work. It works with vitamin B12 and vitamin C to help the body break down, use and create new proteins. It is also involved in the formation of red blood cell and prevent anemia. The next micronutrient is zinc. Its recommended intake per day is 11 mg. Zinc aids in proper immune function and metabolism. Zinc is also important for wound healing and proper sense of taste and smell. Phosphorus. Its recommended intake per day is 800 mg. The main function of phosphorus is in the formation of bones and teeth. Next is potassium. Its recommended intake per day is 5 gram. Potassium helps muscles to contract and supports normal blood pressure. Sodium. The recommended intake of sodium per day is 5 gram. The body uses sodium to control blood pressure and blood volume. The body also needs sodium for muscles and nerves to work properly. Next is magnesium. Magnesium intake per day is 310 mg. Magnesium helps in muscles and nerve function, blood glucose control, and blood pressure regulation. Now we'll move on to the importance of nutritious diet. The first point is it prevents many diseases. A well balanced diet provides the body with the immunity that is needed to fight against various infections and diseases. With adequate nutrition, the immune system of the body works well and prevents diseases like diabetes, high blood pressure, cancer, and heart diseases. An adequate nutritious diet helps in weight control. Weight control can be achieved easily by eating right food in adequate quantity instead of not eating at all. It helps in regular menstrual cycle and prevents premenstrual symptoms. It helps the body to function properly and reduces mental disorders. The next point is it keeps skin, teeth and eyes healthy. Supports muscle function. Supports healthy pregnancies and breastfeeding. Supports reproductive health. It helps to strengthen bones. Improper food intake leads to anemia and nutritional deficiencies, which can cause a significant threat to a woman's health. Healthy food works wonders for women and builds a strong body. Women who are of good nutritional status are healthier and more productive than poorly nourished women. In brief, proper nutrition is an essential part of healthy development. The best nutrition is significantly mandatory for women. I conclude this video by stating eat healthy, stay fit. Thank you.